My name is Samara Friedman. I'm a pediatric orthopedic surgeon. I did my undergraduate work at Cornell University, followed by medical school at Stony Brook University on Long Island. I then went on to orthopedic residency at Long Island Jewish Medical Center, followed by a pediatric orthopedic fellowship at Children's Hospital of Philadelphia. What inspired me to choose orthopedic surgery was a number of different things. I was actually 17 and doing a summer program focused on biology because I knew I wanted to become a doctor. And there was a surgeon who showed a video of a gallbladder removal, and I knew instantly upon watching that video of the surgery that I had to become a surgeon. I also, though, did not really find the gallbladder particularly interesting, but I did enjoy working with bones, joints, muscles, and found that system of the body particularly interesting, in part as an athlete and also in part because I liked fixing things with my hands. And that sort of fixing satisfaction, the satisfaction that comes with fixing things, was in part what drew me to orthopedics, specifically pediatric orthopedics, because I just love working with children, seeing them improve, seeing them go back onto the sports field, and then go on to success after recovering from their injuries. My greatest patient success story would have to be a middle schooler who was unfortunately struck by a car coming home from school, who had very severe injuries to one leg in particular, which he almost lost, as well as other upper extremity injuries as well. And one day he did actually end up going back to playing soccer. Just seeing how happy he was being back on the soccer field and being active after such a horrific injury would have to definitely be my greatest success story, just to see how he really worked so hard to overcome this type of injury and get back to the sport that he loved. I try to make my patients feel most comfortable when I meet them by addressing them directly. As long as they're old enough to speak, to listen, I will address the patient themselves first before the parent. Might play a little peekaboo or something if they're particularly young. If they're older teen, of course, they don't seem to be too interested in peekaboo anymore. So I still address them directly before I really address the parents, and I treat them how I would have liked to be treated at that same age. Do I have a role model? The answer to that, unfortunately, is no. I am a female orthopedic surgeon, and there are only about 6% women in this field. And so it was very difficult throughout training to go forward without really any woman as a mentor in a field that had so few women at that time. Now that's changing, and even in our group, we're now 50% female, which is very atypical and also really quite incredible. And while I didn't have a role model, I try to be myself a role model for the more up-and-coming women in the field, at least to the extent that I can.